Life and death is part of life. It will always be with us. There will always be life, birth of your grandchildren, your children, death of your parents, your grandfather, it's only a matter of sooner or later. So why be so superstitious about it?
Michael is a wonderful patient. I've been seeing him for more than a year. He initially had issues with kidney disease, and he will talk about his family, and then he brought up how his son had to be admitted to the hospital for 1 month and he passed away, and he saw him suffering in the ICU. And he just brought it up himself, like, I really want, like, none of this happens to me. So then that initially prompted me to discuss about advanced care planning, that have you discussed this with somebody? And then he told me he just lives with his wife, who is also an elderly. He said, Doctor, can I just discuss with you? Then I'm like, of course. He really wants everybody to know what his wishes are. And it was really not me getting him on board. I think it was him prompting and then making me think about the advanced care planning for him. So the wishes documented in advanced care planning, they help us provide care which are aligned with patient-centric goals and really what they want as well, in addition to our medical advice, of course. Yes.
I had a long talk with him on what will happen, and then when he passed on, then when we were making arrangements for the funeral, the wife intimated to us what are the things he wanted. So we did exactly what he wanted. When he died, it was going to be a celebration of his life. He don't want people to be sad. He told them to wear the best happy party clothes, and he himself didn't want to be dressed formally. He wanted to be dressed in his best Geelong Cats, the jersey, because he loved the Australian football, so he supported Geelong. He wanted that jersey, he wanted to wear that one, and then he wanted to be cremated. And not only that, as a Catholic, he didn't want to be buried. He wanted his ashes scattered opposite the field, where from his office you overlook a field. There was one big tree. He wanted to have his ashes scattered around that tree.
So too young, they don't feel it's necessary. And then again, too old, many of our patients tend to leave many of these discussions to their children. Like, okay, yeah, they will just make decisions for me. So it's somewhere in the middle-aged to not so elderly patients who are nowadays more upcoming. But then I think something which is also interesting and encouraging is that previously we had to broach this. But in the last few months, I've had patients, they will come and ask me, yes. So they have asked, like, I want to write down my wishes. What are the various options available? But there is still sometimes a confusion between an AMD, which is an advanced medical directive, and advanced care planning. They basically want to do advanced care planning. They want to let everybody know what their wishes are, and they think that AMD may be the best way to do so. So when we explain, like, okay, there's an easier way, you don't even have to go anywhere, we can just do this for you, then yes, they very willingly take it. Yeah, it's really not about form filling. Many of our patients are afraid about, like, okay, if I sign something, then that's the end of my life and I can't change it. But we really focus that it's about discussions. If they are keen but they don't want us to sign a form, but they are willing to have this discussion, we do have avenues to just record these discussions in our medical records, have this discussion, so they are accessible to doctors as well as the healthcare team taking care of them without actually having to sign a form. So that is one option. And the other thing, so we do also encourage, there are some worksheets which are available for patients to just do at home. If they don't want to come here and have a form, but they just have some thoughts, just pen down those thoughts. So we do have those brochures available, and they can show it to their loved ones. And the purpose is just talk about life as well as death together with your family members, even if it's done in the comfort of your home.
Because you never know when you are about to go. I may suddenly get COVID-19 tomorrow and I just go. There's absolutely no way, you can't tell. So the earlier it is done, the better. Because you wait till you are on your deathbed and then you can't even talk properly, and then people can't make head or tail of what you are talking about after you pass on. The people who are left with your corpse, they may undergo very heavy stress, which is very true, and then for them, force them to make very important decisions, very difficult. They may make the wrong decision. So while I'm still living, what will happen to me is better for me to give people advance notice what happened, so that when I pass on, they refer to what I had there and they just follow exactly. That will make things so much easier for them. So I thought that's a good program. I will take part in it.
COVID has really moved everybody, right? It's not just us, throughout the world. And there is all this fear about, okay, what if I get COVID, I end up in ICU? And so yes, of course, the anxiety levels are high, and people are willing to discuss about some conditions, because previously there was this conception that if I'm healthy, I really do not need to talk about end of life. I'm perfectly fine. But now with COVID, we are increasingly seeing like even healthy people can have adverse outcomes many times. And yes, so the interest has gone up, at least in my practice. I've seen some patients discussing this, and COVID-19 related care is also something that we try to incorporate in our advanced care planning discussions. Yeah.
Sometimes when we talk, reminding me of, especially at the day of his death, some tears will come into the eyes, that's for sure. Then we just get over it.